Okay, we were talking about hiatal hernias and gastroesophageal reflux disease. And of course, the hiatal hernia is one of those conditions that probably is precursor to GERD, and one of the most common causes of GERD that we get, which is the most severe form, is actually emesis, where you actually get reverse peristalsis of the gastrointestinal tract, and we emesis or vomit. And and on a smaller scale, reflux is basically vomiting on a very smaller scale. And so the long-term complications of acid being introduced into the esophagus are basically the same conditions that we've talked about before, where in essence, what happens is the esophagus is a smooth muscle and a kind of a barrier as you push things through your esophagus, and they have to open up into the sphincter in your stomach where it tightens and holds that acid in it. And the pH of the stomach can actually get quite low. The thing that's interesting about that is that acid being introduced up into that thing can cause a change in the lining of the esophagus, and that changing of that lining is a condition we call in medicine and all through any biophysics is called metamorphosis, meaning or metaplasia, where a cell type will change from one type to another. So I didn't mean to confuse you on that term. But metaplasia is a term where maybe a body responds to a particular stress on a cell type by changing that cell type, and that's a genetical change. It's basically a survival type thing, where basically if you look at someone who's out in the sun all the time, they'll develop thick, hardened skin. And that thick, hardened skin is what protects us from more ultraviolet radiation. And that's why tanning booths were so horrible, because they gave people a very false sense of security by giving them a tan, but didn't actually thicken the skin, and therefore provided no barrier to UVB, or ultraviolet B radiation. And UVA is what they would use in the tanning booths, and UVB is the deep penetrating radiation that penetrates deep in your skin. That's the one that causes skin cancer. So you get this nice glow, and then you go out to the sun and you think, well, I'm going to be protected because I got a nice tan. And that's the absolute falsehood of tanning booths. And they are actually, in my mind, are much higher risk for skin cancer for someone who's in a tanning booth. So anyway, not only the fact that UVA dries out your skin and causes wrinkles, so not only did you become a prune from hanging out in the tanning booth, in the tanning salon, you actually were higher risk of skin cancer. So it's a little take-home pearl for you tonight. Stay away from the tanning booths. Get your sun exposure slowly and naturally, usually 15 minutes on a side, kind of like an oven. Do that over naturally, and that gives your skin a chance to respond to the ultraviolet radiation in an appropriate form, thicken the skin, and give you more of a protection from further ultraviolet radiation. Well, that process also takes place in just about everywhere. We've talked about it in COPD, and now it's also evident in chronic acid being exposed into the esophageal area. And anytime that happens, you get the risk for cancer, because if you're that's why drinkers and smokers will tend to have a 100% chance of cancer. Alcohol being an irritant and smoker being a carcinogen, you've got this combination of flame and fire, gas and fire, so you're basically going to ignite one of those sooner or later. At any rate, getting back to that, that's one risk, is esophageal cancer, and usually it's long-standing. So before you get that, you may get Barrett's esophagitis, which is actually an erosive esophagitis, too much acid causing erosions into the skin, into the esophagus, and that will be a very chronic, painful situation. And then long-term exposure, you might get stricture in the esophagus, meaning it's been irritated and scar tissue sets in. And when scar tissue sets in, then the esophagus narrows, and then you'll have a term called dysphagia, where you have difficulty swallowing. Products will, as you swallow, will get stuck. And I had a patient recently who went to the emergency room because she was eating maybe a little too fast or a little too big piece of meat, and it got lodged right down in there. And that's a very disconcerting situation. She wasn't choking, she just couldn't push that through. And so that could be something that might happen as a result of long-standing gastroesophageal reflux disease. The other thing that happens at a chronic GERD is a chronic cough. One of the things that acid is very irritating, so if it bellows up through the esophagus and can come up over into your windpipe, it can be irritating to the bronchial tissues, and actually is a cause of chronic obstructive lung disease is chronic exposure to acid, causing a chronic bronchitis and a chronic cough. So beware, you may not smoke, but you may have chronic reflux disease, and you may end up developing chronic obstructive pulmonary disease. So these are one of the things that you can be aware of. Now, medications to help treat that, obviously there are the older products like Zantac and Pepcid and Axid. Those are antihistamine medications that limit the acid due to, basically one of the processor I believe H2 blocker, and they will block the histamine being, and they're very mild. They work extremely well, but they're very mild. They've been out on the market. Also good to keep in mind if you have a lot of seasonal allergies, sometimes taking a little Zantac with your other antihistamine might give you a 1-2 punch to help fight allergies. But we can talk about that on another segment. But those products work quite well. You can buy them over the counter. They've been out for years. They're relatively safe. I don't see any particular problems with them. And then there are the, let's see, we have, I want to interrupt the treatment. We have Chuck on the phone. Chuck.
Hi, Doc. This is Chuck. You just described my dilemma.
Okay.
I've had chronic heart disease since 2010, and coincidentally, I've had GERD, I've had hiatal hernia, and all kinds of problems with the symptoms being identical. Mm-hmm. In fact, I just spent Christmas getting my 16th angiogram.
Oh, wow.
And that's after 2 failed open hearts.
Yeah.
So I just want to verify what you say. It's a nightmare because you cannot tell the difference.
Correct.
Basically, I go in, have my heart checked out. If there's troponin, I stay. If there's not, usually I leave the ER. But in this case, there was enough symptoms that I had to have another angiogram. But it was negative, so everything's cool.
Oh, congratulations on that.
It's a wonderful show. I can't believe you brought this subject up because it is so coincidental with what happened to me and what I was very eager to call you about.
Good.
Thanks a lot for the description. It really helped.
You're welcome, Chuck. Thank you for calling and letting me know. Yeah, I try to pick a few topics that come up into the office that during the day. These are everyday things that, as I'm explaining them to patients, I realize that this is a common problem, a good thing just to talk about on the show. So as you if we're sitting in my office, this is basically the same discussion I might have with you regarding this particular issue, and you're living that nightmare of having a history of a heart problem, and nobody is going to take it on face value that it's not your heart. They're always going to go to the stuff that could cause you most difficulty. So, it's like, I think it's my stomach, I hope it's my esophagus, but I also have had several bypasses and stents. Well, they're going to forget about the esophageal problem and they're going to rule out your heart, because your heart will kill you, your esophagus will make you uncomfortable. So that's
fortunately, it's back in July, I had an EGD and a colonoscopy, so my cancer situation is not there.
That's good.
So it's just the heart and prostate cancer I have to worry about.
Yeah.
Piece of cake.
That's enough.
Okay, talk to you later, Doc. Thanks.
You're welcome, Chuck. Thank you for calling in. And so Chuck is living that unfortunality. So, and I'm sure there are a lot of people out there in the viewing audience that are also have experienced that. And as you get older, the heart becomes more of a concern. But and I'm bringing this up for the public to understand that just because you have both of those symptoms, you always have to assume that it is your that it is reflux. I had that could be your heart. I had a good friend of mine who was belching a lot and was having some other chest pain discomfort, and I basically told him, I said, you know, you can't ignore the fact your heart. And he went to the cardiologist, and sure enough, he had a 4 or 5 way bypass. So heart disease is a very common problem, especially if you're a diabetic and you have those risk factors. So getting back to the reflux problem, the Zantacs and the Pepsids of the world are very good products. And now we have the over-the-counter proton pump inhibitors, which can kind of give you that 1-2 punch, which you can use both of those together to get better reflux control. And we know those as omeprazole or Prilosec or Nexium or those other brand names that have been out there for a while. Most of them are going generic, and you can get those now over the counter. So using those products can be very, very helpful. One of the things you need to keep in mind that if you are a female and you are using some of those proton pump inhibitors and you're taking calcium for osteoporosis, calcium carbonate will not work and you will not absorb the calcium. So it has to be calcium citrate. Make sure if you're a female taking a proton pump inhibitor, you're using calcium citrate as your calcium source so you can get that calcium. There was a long, when these proton pump inhibitors came out, there was an initial report that they caused a carcinoid tumors in mice, and so you weren't supposed to be on them for longer than several months. And that has since been dispelled. That is not the case. But when you do take a proton pump inhibitor and you do reduce the acid in your stomach, you will sometimes suffer from the likelihood of getting a little, maybe possibly a few more illnesses and things of that nature, because the acid is a very strong inhibitor of bacterial growth, and it kills everything. It helps in digestion, also some of the enzymes. So it is important that you remember that if you're on these, maybe to give yourself a break every once in a while and go to a Pepsid or something like that, that acid build back up in your stomach and try and kill some of those things that need to be killed. We're going to go to break, and we're going to talk about H. pylori as a bacteria that has been found in that, and that is one of those interesting things. So we'll be right back, and again, thank you for tuning in, and your calls are always welcome.